Hello, my name is Dr. Jerry Crouch. I am founder and partner in Advanced Smile Care, and as part of our ongoing educational video series, today we will be discussing periodontal or gum disease. So if you've been told you have periodontal or gum disease, you're not alone, because 50 to 75% of the adult population has gum disease. Along with dental caries, what we talked about last time, gum disease is one of the most common illnesses affecting humans, common cold being the most common. And like the common cold, common does not mean normal. We all know that a cold is not healthy. Well, bleeding gums and things that cause gum disease is also not healthy. Just because it's common does not make it normal. What causes gum disease? Well, all of us have bacteria that are present in our mouths. They're present all the time, and if we never brushed them off, they would just cause all sorts of dental problems for us. So the bacteria form sticky little layers on our teeth called plaque, and the plaque is that sticky stuff. When you wake up in the morning, you feel like you have a sweater on your tooth. That's dental plaque. Dental plaque is just colonies and colonies of bacteria, and these bacterial colonies are what cause the gum disease. Now what happens, and when you go to the dentist, what they clean off is the tartar. Tartar is calcified colonies of bacteria. So the hard deposits that get on our teeth are calcified. It's like little fossils of bacterial colonies that are hooked then onto our teeth. The plaque is soft. Plaque can be removed daily by us individually, but tartar, when it becomes hardened and stuck to the teeth, that can only be removed professionally by generally a trained dental hygienist or a dentist. Now the inherent cause of gum disease is bacteria, but there are some risk factors that can preclude people to have gum disease some people more than others. One big one is smoking. Smoking is a huge risk factor for all dental disease, but especially gum disease. And smokers, it tends to mask the bleeding, which is one of the early signs of gum disease. And you have the destruction without necessarily seeing the bleeding when you're brushing and flossing your teeth. Diabetes, and November is National Diabetes Month. Diabetes is a huge problem with gum disease, and it's kind of a vicious circle with diabetes. Inflammatory things in our body, infections in our body, affect our diabetic components, and diabetes affects the ability to react to diseases. So periodontal disease can be a huge factor in diabetes, and diabetes can be a huge factor in people having periodontal or gum disease. So how do I know I have gum disease? Well, number one is bleeding on brushing and flossing. And we tend to all brush the same way every day. So if we may say, well, I only bleed when I brush really hard, or every now and then I get food caught in my teeth, so I floss. So if you're flossing every day, one, you're removing a lot more bacteria, and if you brush differently, you may disturb areas of your gums that are not seen. So any kind of bleeding in your mouth is a sign that is gum disease. And once again, bleeding is common, but it's not normal. All right, so it's not all bad news though. Gum disease, in addition to being one of the most common diseases known to man, is also a preventable disease for the most part. And certainly in the early parts of finding out about gum disease is a very treatable disease. So there's two phases of gum disease. Gingivitis is the one that the rinses and the toothpaste, they all talk about treating gingivitis. And the fact is those products do limited use on their own, but when applied on a brush or floss and are able to remove the soft plaque on a daily basis, we can prevent gum disease. And if you have gingivitis and you get your teeth scaled and clean, then gingivitis is actually fully reversible to healthy situation and not have any long-term damage. The second phase of gum disease is periodontal disease, and that's where there's bone destruction. So it goes from gingivitis to periodontitis, and periodontitis, bone has been permanently destroyed. So how do we get that situation under control? Well, if it's early enough, we can treat that just without surgery, doing what some people call deep cleanings or scaling and root planing. Many times we go in and have to numb the areas to get down deep enough where we can clean these tartar deposits and bacterial deposits out, get the root surface of the tooth clean from debris, and remove the toxins that are in these pockets, and at the same time irrigate with medications that help physically kill the bacteria. Now, sometimes areas are destroyed, bony areas are destroyed, and just to kind of give you an idea what that looks like, the bone around the teeth gets washed out and eaten away. Now, sometimes these areas can be repaired, so surgical intervention might be necessary to create a better architecture of the bone and to remove a deeper pocket. And now with some of our newer techniques, we can actually add bone back in some areas. Typically the bone will not grow back on its own. It's one of the sad things about gum disease. Once that level of bone is destroyed, then this bone will not grow back to a healthy situation. So sometimes surgery is involved. Most of the times these days, and with most people, non-surgical techniques are certainly preferred, and we can get by with that and get people healthy again with non-surgical techniques. Thank you so much for your time and tuning in to another episode of Advanced Smile Care's educational videos. And for more information on this topic and many other topics, you can visit advancedsmilecare.com, and a lot of these videos are available on YouTube as well. Thank you.